anonymous attendee who asked, can Dr. Agrawal shed some light on IPF and the treatment for it?
IPF. So now, when we speak about IPF is a very, very specific disease found usually in men over the age of 60 years. They are usually patients who have had some form of smoking in their life. They may have a history of GERD, that is acid reflux. But there is, by the very nature of the name, IPF stands for Idiopathic Pulmonary Fibrosis. Idiopathic means we do not know the cause of this disease. And to date, we do not know what causes this disease, why there is fibrosis developing in the lung. And this is usually a diagnosis of exclusion. That means you try reasoning out why a person may have lung fibrosis. And when you can't find plausible reasons for his fibrosis, you term this as idiopathic pulmonary fibrosis. The treatment for pulmonary fibrosis is actually very specific, as in it depends upon what a patient needs. You may or may not be given an anti-fibrotic or a medicine which prevents progression of fibrosis. But to understand, or to make you understand, one very important thing is that this disease is progressive. It worsens with time. So you will have a steady deterioration or reduction in your lung function as you go along with the disease. Now, the other forms of treatment, or something which will keep your quality of life intact or will prevent a rapid deterioration in your quality of life, is that you eat well, by which I mean you have a high protein diet, you maintain your muscle mass, and for that you need to ensure that you are exercising in the right way. So you need to get proper lung rehabilitation or pulmonary rehabilitation. Another thing that your doctors would do is that they would vaccinate you, and this is extremely essential to prevent any secondary infection, because when you have a lung with fibrosis, you become much more vulnerable to infections which can suddenly deteriorate or worsen your illness. That's your lung fibrosis. When I speak about prognosis, the 5-year prognosis is pretty grim, and most patients, or rather the 5-year prognosis is about 10 to 12%.
Subscribe now and press the bell icon. Never miss an update.